Varicose veins are chronically dilated and tortuous superficial veins with reversed blood flow due to incompetent and damaged valves. This can affect your lower limbs health. Varicose veins can be a purely cosmetic inconvenience or the sign of an underlying medical condition. The pooling of blood in the lower limb extremities may lead to swelling, skin changes, and ultimately the risk of developing ulcerations. The reality is varicose veins may affect the young and fit as well as older people, men and women equally. Early diagnosis and treatment can prevent varicose veins from worsening, which is why we recommend seeking professional medical advice sooner than later. Check the skin of your legs for any signs of discoloration. Can you feel any uneven, dry, hardened texture? Do you suffer leg swelling, especially at the end of the day? Risk factors include the predisposition or family history, previous injuries, long bone fractures, orthopedic surgery, or deep vein thrombosis that we call DVT. You may have an increased risk of developing varicose veins if you are pregnant or have had multiple pregnancies, stand for long periods of time at work, or have a sedentary lifestyle. If you are overweight for your height, have you reduced movement or ankle joint or calf muscle waste? There are different stages of venous disease, and we call them the CEAP clinical classification, and comprises of 6 different stages, from cosmetic inconvenience to active leg ulcerations. And that is why it's best to undergo a thorough and comprehensive vascular assessment and a duplex ultrasound scan to reach a proper diagnosis. Spider veins, also referred as the thread veins, are tiny, dilated blood vessels, capillaries, arising from a central point and resembling a spider web. They usually occur near the surface of the skin. Spider veins can be perceived as a cosmetic condition, although have no clinical implication per se. Leg edema is the buildup of fluid, and this may leave your legs feeling heavy and aching. Skin pigmentations or eczema are signs of significant venous insufficiency, making the skin drier and more susceptible to breakdown. Venous leg ulcerations are a physical, psychological, and economic burden. Appropriate wound care, timely compression therapy, and varicose veins keyhole surgery are paramount. When you come to see us, we will design a bespoke treatment plan that works for you. There are a variety of therapeutic options aiming at achieving the best clinical and cosmetic outcomes. Treatment range varies from cosmetic sclerotherapy for thread veins, and you have all heard about from Sue, to more complex varicose vein surgery by means of endovenous thermal ablation and possibly surgical avulsions. First of all, we will review your medical history and get to know you and your routine. This will help us to develop a holistic outlook of your condition. A duplex scan of your veins will help to assess the anatomy and physiology of your venous system and to inform the most suitable treatment strategy. If you have spider thread veins and no underlying venous condition, you could be amenable to cosmetic sclerotherapy.